Are you living with daily joint pain? And maybe your knees hurt when you walk, your hips feel stiff in the morning, or your shoulders ache when you lift your arm. Chronic joint pain can make even simple things feel hard. And many people feel stuck, like they've tried everything but nothing lasts. But what if your own blood, yes, your own blood, could help calm down inflammation and support the joint from inside? Today, we are talking about a treatment called Platelet-Rich Plasma, or PRP. I will explain what it is, how it works, what the treatment feels like, and what the science says about it. By the end, you will know what PRP can do and what it can't do. So let's get started. What is cartilage and why does it get damaged? Inside your joints, the ends of your bones are covered with a smooth, slippery material called cartilage. Think of it like a cushion. It helps your bones glide smoothly, but cartilage has one big problem. It doesn't have its own blood supply. When you cut your skin, blood brings healing cells to fix it. Cartilage can't do that. So, when cartilage is damaged from injuries, aging, arthritis, it struggles to repair itself. The once smooth surface becomes rough, and that rough surface causes pain, stiffness, and swelling. And grinding in the joint without good cartilage, sometimes bone can start rubbing on bone, and that leads to even more pain and inflammation. For many years, doctors believed that once cartilage was gone, it was gone forever. But now, new treatments like PRP are giving us some hope. Before we talk about PRP, let's look at the usual treatments for joint pain. First, there are the pain pills, like ibuprofen or naproxen. This can help reduce pain and swelling, but they don't fix cartilage. Second are the corticosteroid injections. This can work fast and reduce pain for weeks or months, but the relief doesn't last long. And too many steroid shots may hurt the cartilage over time. Third, hyaluronic acid injections, also called gel shots. This helps the joint move more smoothly. Some people feel better after this, but again, it mostly reduces symptoms. It doesn't rebuild or repair the joint. So, most treatments focus on temporary relief. They help you feel better, but they don't improve the health of the joint itself. That's why doctors and scientists are so interested in regenerative treatments and treatments that use your own body to help support healing. And that brings us to PRP. PRP stands for Platelet-Rich Plasma. And the cool part, PRP comes from your own blood. And here is how it works. First, a small amount of your blood is taken, just like a normal blood test. The blood is put into a machine called a centrifuge. Then the machine spins very fast and separates the blood into layers. The middle layer is the important one. It is the platelet-rich plasma. PRP looks like a golden-colored liquid. It has 5 to 10 times more platelets than regular blood. But why platelets? Because platelets are tiny healing cells. When you get hurt, they rush to the injury and release growth factors. These are special signals that tell your body to repair the damage. So PRP is like concentrating your body's own healing powers and sending them exactly where they are needed. When PRP is injected into a joint, something interesting happens. The platelets become active. They release a burst of growth factors, most of them in the first hour. And these growth factors can reduce inflammation, which helps with pain, support cartilage cells, helping them stay alive longer, help build and protect the joint environment, and slow down cartilage breakdown. PRP changes the joint from a place of breakdown to a place of support. Now, it is important to say this clearly. PRP is not a miracle cure. It does not grow brand new cartilage for everyone, but it can make the joint healthier and reduce pain for many people. Many people feel nervous about injections, but the PRP procedure is actually simple and usually quick. Here is what happens. Your arm is cleaned and a small amount of blood is drawn. Then the blood spins in the centrifuge for about 10 to 20 minutes. While that happens, the doctor cleans the skin around your joint. Some doctors use ultrasound to guide the injection, and this helps place the PRP exactly where it needs to go. Then the PRP is injected into the joint. Most people say the injection feels like pressure or a mild soreness. After the injection, you might feel achy for a few days. This is normal. It means the body is starting a healing response. Most doctors recommend rest for the first day, avoiding intense exercise for a few days, and then starting a gentle movement or physical therapy after that. And most people go back to normal activities quickly. What does the science say? This is the big question. Does PRP actually work? Well, over the past few years, the science has become much clearer. Research shows that PRP often works better and lasts longer than steroid injections. PRP often helps more than hyaluronic acid, the gel shots. And many people feel relief for 6 to 12 months. Some even feel better for longer. PRP does not reliably regrow large areas of cartilage. But here is something important. Not all PRP is the same. Different clinics use different machines. Some have a high platelet count and some do not. And the dose matters. The number of injection matters, and that's why results can be different from person to person. Who might benefit from PRP? PRP tends to work best for people who have mild to moderate arthritis, have joint pain but still have some cartilage left, those who want to delay or avoid surgery, have tried other injections but want a longer lasting option. PRP may not work as well for people with severe bone-on-bone arthritis. But even then, some still feel better because PRP reduces inflammation. So, what is the bottom line? PRP is one of the most promising treatments for joint pain that we have today. It is safe because it comes from your own blood. And it doesn't just cover up pain. It supports your joint's healing environment. And for many people, it gives longer lasting relief than other injections. But it's not magic. It may be expensive, may not be covered by your insurance, but it can help you move better, feel better, and get more out of your life. If joint pain is affecting your daily activities, PRP is definitely a treatment worth discussing with a qualified specialist. This video is not intended to provide you with medical advice. It's for educational purposes only. And if during this video you have an emergency, please call an ambulance or go to the nearest emergency department. And talk to your doctor about possibly trying platelet-rich plasma injections for your knee or hip pain. Have you ever tried PRP, or are you thinking about it? Let me know in the comments below. I would love to hear your experience. If this video helped you, please hit a like and subscribe, and share it with someone who might benefit. Thanks for watching, and take care of your joints. Goodbye!